The CDC's COVID data tracker reports an uptick in COVID-19 cases, with test positivity reaching 6.6% for the week ending June 15, marking a 1.2% increase from the previous week. Emergency department visits for COVID-19 have risen by 14.7%, now accounting for 0.7% of visits. The CDC's weekly snapshot indicates that COVID-19 infections are growing or likely growing in 39 states and territories, while being stable or uncertain in 10. The severity indicators, hospitalizations, and deaths, also show significant increases. Hospitalizations through June 1 have surged by 25% from the previous week, while deaths have risen by 16.7%. Despite these increases, the overall rates of hospitalizations and deaths remain lower than the peak periods of the pandemic. This suggests that while there is an uptick, the impact is not as severe as it has been in the past. According to the CDC's National Wastewater Surveillance System, COVID-19 levels in wastewater are generally low nationally. However, several states in the West are reporting high viral activity, and 6 states, Alaska, Hawaii, New Mexico, Missouri, Florida, and Connecticut, are experiencing very high activity. Data from Wastewater Scan, a national wastewater monitoring system, indicate that COVID-19 levels in wastewater are high on a national scale, highlighting regional variations in viral activity. The rise in cases appears to be driven by the emergence of new variants, specifically KP.3, KP.2, and #.1. These variants now account for 71.4% of sequenced samples, up from 61% the previous week. All 3 variants are offshoots of the JN.1 lineage and possess key mutations in the spike protein, potentially enabling them to evade antibodies. The CDC projects that KP.3 and #.1 will continue to increase in proportion among the variants causing COVID-19. In contrast, seasonal flu activity remains low, according to the CDC's FluView report. However, the report noted 3 additional influenza-associated pediatric deaths for the week ending June 15, bringing the total for the 2023-24 season to 178, compared to 185 deaths in the 2022-23 season. This highlights that while COVID-19 cases are rising, flu activity is relatively low, although pediatric flu deaths remain a concern.